Mr. Bloom, you've been with CMS since 2009, is that correct?
Correct.
You've been in this current position, number 2 guy, for what, about a year?
Roughly speaking, yes.
I certainly can understand a new coach coming in wanting to do something kind of drastic, but quite honestly, and I do commend you on the transparency aspect of this proposed rule, but I think the rule is boneheaded. In fact, Bill O'Reilly would probably call it pinheaded. I would expect, since you've been around since 2009, that you know on, let's say, a 5-year average, the last 5 years, how many participants in Medicare Part D, the prescription drug plan, have reached the donut hole. What percentage on average over the past 5 years?
Don't have the numbers in my head, but what is true is many fewer beneficiaries are hitting the donut hole because it's being closed.
Yeah, but I suspect that number is pretty low. I'm surprised you don't have that. Maybe somebody behind you could whisper in your ear and tell you.
But I believe the numbers are roughly year to year.
Well,
and it changes year to year. Roughly 3 to 4 million Medicare beneficiaries hit the donut hole.
Yeah. Yeah.
Each year. However, but
I would suggest that you're trying to kill a gnat by torching a village. You're trying to fix things that are not broken, and to do it, maybe the optics of closing the donut hole look great, and so you have to go back and say, well, we're going to look at these protected classes, and we're going to do something about that, and we're going to save money. So we can close the donut hole. And look, listen to these 6 drug classes: anti-neoplastics, that's cancer, ladies and gentlemen; anticonvulsants, maybe we ought to add marijuana to that; antiretrovirals, that's AIDS drugs; antipsychotics, antidepressants; anti-immunosuppressants. These are people that have had transplants, renal transplants. And if they don't get the drugs necessary, within 3 to 5 years, they can't pay for them, and all of a sudden they reject these transplants. I wish I could tell you that I was shocked at the egregiousness of this proposed rule and that this was all just a mistake, but that would be too kind. At this point, we must recognize the pattern of this administration attacking any health care program that empowers the free market, no matter the pain it causes beneficiaries. I personally, as a physician, find it reprehensible that the administration is so against any market-based system that they are willing to once again harm seniors to serve the purpose. My colleague from Maryland said, every now and then you have to kick the tires to see if a program is working. Well, on the Affordable Care Act, every time you kick the tires, your foot goes through the sidewall. So maybe you're a little reluctant. So you kick the tires of a good program, and your foot comes bouncing right back in your face. And that's what's going on here. And let's be clear. This proposed rule will destroy the Part D program as we know it. It will limit our seniors' coverage options, and it will force higher premiums, unwarranted changes to a program where beneficiaries are overwhelmingly satisfied. It just doesn't make sense. Now, Mr. Bloom, even as I disagree with the contents of the rule, I also question whether CMS, you guys, even have the legal authority to reinterpret the clear congressional intent in the Medicare Modernization Act of 2003. I was here. I was here when that was passed. The Energy and Commerce majority staff requested that CRS review the legality of your actions, and we requested a memo in response. The memo cites, and I'll just give you a little bit of it because I'm running out of time, a Supreme Court decision that interpreted a statute, a court should always turn first to one cardinal canon before all others, that a legislature says in a statute what it means, and it means in the statute what it says. Mr. Bloom, Congress has opined on this. Why does CMS feel the need to act at all when the law is crystal clear on this issue?
Well, I haven't seen the CRS report. I would welcome having a chance to look at it.
Well, Mr. Chairman, I will request unanimous consent that we make this report from the Congressional Research Service on the proposed interpretation of the non-interference provision under Medicare Part D as part of the permanent record.
Without
to come back to
objection,
the,
so
Let me just conclude. I am urging you, Mr. Bloom, to withdraw this rule. And I personally, as a member of this committee, am prepared, and I will also urge our leadership, fight with every tool available to repeal this rule legislatively if you guys do not heed the wishes of our seniors and the American people. I've gone over my time, and of course I'll yield back, Mr.